Whatever you want.
So let's see. About 15 years ago. Well, actually, let's start over again. About. How do you get at this?
No, you keep going. Yeah, just.
About 30 years ago, I damaged my knee. I was racing motocross. I was 16. So I guess it was 34 years ago, since I'm 50 years old now. And tore it up pretty good. I got to the point where I could hardly walk on it. In those days, they just removed the cartilage. They had the cartilage removed at Stanford University. Everything went good for about 8 years. And then it started going downhill in a hurry. My knees started being continuously sore. I started being concerned about being able to walk or what was happening. So I went to several orthopedic doctors and didn't get any good answers. I was kind of at a loss for what I could do. I was too young for a replacement, and they basically told me, three orthopedic doctors told me I need to slow down because I'm too young for knee replacement, and had a long way to go, and I had to save that knee. So I became really concerned because I'm an active person. I did all types of activities, just recreational. And so eventually, through one of those facilities, I learned about Dr. Stone here in San Francisco. Came to San Francisco, saw Dr. Stone. He looked at me and he says, "What do you want from me?" I told him what was wrong, what was going on. He said, "Okay." I said, "What?" He said, "Okay, we'll fix it. We'll get it so you can ski and do whatever you want to do." So I was kind of floored at that point, thinking, and that's what I wanted to hear from the other doctors. So I left that appointment feeling really good about what's going on. And then you start thinking, well, this is the only guy that's told me this, but I did a lot of research on Dr. Stone and his facility and what he was researching, and found out this is exactly what I was looking for. I was actually told by one of the other surgeons that I saw that what Dr. Stone was doing was not proven, and he doesn't think it's going to work, or that it works, and that nobody wants to do the therapy that's required. Most people won't do the therapy required to make it work, even if it will work. So he wasn't even look at it. So anyway, I was ready to prove all that wrong, and I was ready to work and do whatever I needed to do to make it right. So in about 1996, Dr. Stone did first off, in about 1994 or 5, when I came up to the clinic, his therapy department, which was very small at that time, got me by for 2 more years, because Dr. Stone wanted to keep improving and learn more about what he was doing and how he could do it. And by I think it was 1997, he was ready to do something with my knee, and I was ready for him to do something with my knee. So I came in, he did articular grafting in January, and by December of that, and my knee had not been, after 2 months, my knee was pain-free. My knee hadn't been pain-free since 1977, roughly, and this was 1997. So for 10 years, I've had knee pain, and this was the first period I couldn't believe it was happening. I started using my knee extremely heavily, and by December of that year, my knee was getting very sore. It was pain-free for about 4 months, and then started getting slightly sore and worse and worse. But I had I had no meniscus cartilage in there to protect the joint. So by that time, he was pretty confident in implanting meniscus cartilage. I came up here and we talked, and he told me what he wanted to do, and I was ready to go. And constantly he was emphasizing how important the therapy was. His therapy department had grown somewhat, and had some very good people in there, and I worked with them, and he implanted that meniscus, and everything went extremely well for 5 years. Um, and I don't know if you want to know this or not, but anyway, everything went really well for 5 years. I didn't go back to skiing. I decided to do snowboarding, and because I could control my knees, they were stuck together, I could control things better. It was the best thing I could have done. Snowboarding is so much better than skiing. I was so blown away. So I went from being a mediocre upper level skier to learning how to snowboard in 2 days and go down the whole mountain. It was incredible. So I had a blast snowboarding. So anyway, trying to figure out where I am in time now. Oh yeah, so my knee was perfectly fine. I did a lot of snowboarding, which was great. I tore my meniscus again, the implant, chasing my nephew down a hallway, and I stopped to twist and turn, and it tore it. Out of all the snowboarding and all the mountain biking and road biking and all the backpacking and hiking I had no problems with my knee until that day. And I came back up here, and I didn't know for sure I tore it. I thought I did. Went to his office, he checked the knee, he said, "You tore your meniscus." Well, that was difficult to hear. But I said, "What do we do?" He says, "I'll fix it." I said, "Okay." So I went back to surgery, he sewed it back together, and that was about 10 years ago. And I have that same meniscus in my knee. The articular cartilage seems to be doing just fine. I missed a part there, though. He did an osteotomy. I don't even remember what year it was.
Okay.
But I think, oh, I know what happened. And you can do whatever you want with this, but at one point, and I was actually riding my bike, sprinting up a climb. I tore a chunk of the articular cartilage out. So, and that was painful, and it was floating around into the pieces. So I came back up to see Dr. Stone. I said, "What are we going to do?" He says, "I'll fix it." So again, I went back into surgery, but he said this time we need to take a little stress off of that medial compartment. So we talked about it. He did an osteotomy to take some stress off that medial compartment. Repaired the articular cartilage. My meniscus was actually fine. Put me back together, and that has been about 10 years now, 9 or 10 years. And everything's been fine. So I don't know what other questions you want to...
How are you doing now?
Oh, anyway, so at this point in time, I am doing fantastic. And what amazes me, my knee has seemed to get better over the last 8 years than it was. It got better slowly after this last surgery, and kind of stayed in one spot, and pretty soon it seemed like it just continually, very, very small increments, continued to get better and better and better. And I'm absolutely amazed at that. I do a lot of pretty hardcore mountain biking. I haven't done any snowboarding just because I haven't had the time. I've done backpacking, a lot of hiking, a little bit of jogging.